Hello, I wanted to talk to you today about reasonable adjustments. Now, reasonable adjustments comes from the Equality Act and is a term that's used to describe things that we need to do as a society to help and support people to either access a service or to feel more comfortable in a service. Now, the Equality Act covers people with protected characteristics. Some of these will seem really obvious, for example, wheelchair users. Others will be classed as what's called hidden disabilities. For example, autism would fall under a hidden disability because you would not be able to tell someone's autistic from just walking down the street. Now, this is an act and it is in law, so this is stuff that we have to do. It's not stuff that we can do if we just got some time. And these can be very straightforward things, and this is what makes them reasonable. So, for example, things that you may want to think about is things related to the person's sensory system. For example, thinking about hearing, thinking about sight, thinking about smell, thinking about taste, and thinking about movement. We can quite easily put movement breaks or encourage people to move around either in a client appointment or an autistic colleague by going, let's go for a walk. This can help reset the sensory system and make sure it's refreshed and ready to go. This is just good working practice anyway for everyone, so it's not going to have an impact on the wider team. Now, there will also be things regarding noise. So, for example, if you are seeing a client who is autistic and you are the professional, do think about the environment you're seeing them. For example, can you remove a ticking clock out of the room? That is often quite irritating and it can be a hard noise to filter out. If you're working with an autistic colleague, think about the open planned office space and the amount of noise that can often be produced in these types of setting. Now, it's hard to reduce that in an open planned office space, but there are things that you can put in place. For example, ear defenders or noise cancelling headphones, and also providing a breakout space where people can go and just recharge if needs be. So these are just two examples of how your sensory system can be supported when in the workplace or when you're supporting an autistic client. Now, you could also look at things like the smells. Now, this is often one that is overlooked. Now, we all will use perfumes or will use aftershaves because we all like the smells of them. However, for some people, these smells can be quite overbearing and quite distinct. Now, that's absolutely fine. It's your personal choice to choose what aftershave or perfume you use, but we do need to consider the impact that may have on our autistic clients or our autistic colleagues. If those smells are extremely overbearing, that can be very distressing for some and can be hard to filter. So if we could choose one that is less overbearing, that can be a big benefit for your autistic colleague or for the autistic client that you're supporting. So for me, for example, I like a nice strong smelling shampoo. So if I'm visiting an autistic client, I usually tie my hair up, or I would normally wash my hair in the evening rather than in the morning on those days. So I just have to plan a little bit more than I would do normally. We also need to think about the visual impact. So, for example, thinking about lighting. Most lighting in most settings can be quite harsh just because it's the volume of light that's used. Natural daylight is usually the best lighting that can possibly be used. So can you see an autistic person outside, or can you see them in a room that's got a lovely big window? If those things aren't available, is there other adjustments we can put in place? For example, providing sunglasses for the person to wear so they're not having to filter out the harsh lighting so much. Also thinking about what you are wearing. So here at Autism Oxford, we avoid wearing patterns because that is quite visually stimulating and can be quite distracting for some. Or even for some people, it can actually be quite distressing and quite physically painful. So do think about what you're wearing as well when you're seeing autistic clients, but also if you're working with autistic colleagues, do ask them if these things will impact them. Simply me changing what I'm wearing will have a big impact and will make life a lot easier for someone and has very limited impact onto myself. So it would be classed as reasonable. Now, we also need to think about time. So as a reasonable adjustment, as a service, we should often allow more time for autistic clients, or we can break down our appointments where possible. We also need to think about the time of day where it's best to see that autistic person. If someone, for example, has quite significant needs around their executive functioning, so planning, sequencing and organising, I may want to choose a time of day for my appointment where they've got more time to kind of plan and make use of those extra supports around sequencing and trying to get themselves to the appointment. Similarly the same when I'm supporting an autistic colleague, or I work alongside an autistic colleague, I may want to ask them at what time of day is best for them and where they are most productive. And this might be the time where I need to prioritise anything I need from them as their colleague, or high priority tasks. Again, these are really simple adjustments that can be made. They have very low cost and actually don't take that much time to implement. Now, there are lots of other different reasonable adjustments you could implement in your workplace. For example, things like easy read and concise documents. It could be providing the agenda to meetings before they happen, so people know what to expect. It could be when you're meeting an autistic client that you provide the questions you're going to ask them ahead of time, so they have time to process what they want to say. All these things would be classed as reasonable because they don't take much time, they don't cost very much, and actually they don't take any specialist knowledge to input. And if you're unsure, please do ask the autistic individual. They will typically have a good understanding of what things will help and what things won't help. So by asking the question, one, it shows that we're thinking about it, and two, you can have a big positive impact.